I'm Dr. Julie Schumacher, a professor and director of the program in psychotherapy in the Department of Psychiatry and Human Behavior at the University of Mississippi Medical Center. This presentation focuses on evidence-based psychotherapy. In this presentation, I'll start off by talking about what psychotherapy is and three of the major types of psychotherapy and how they differ. Then I'll talk a bit about the research on psychotherapy outcomes and how findings differ by type of psychotherapy. An important starting place in the discussion of evidence-based psychotherapy is clarification about what psychotherapy is. Psychotherapy is a different kind of relationship than any other relationship. People who are good at talking to friends, neighbors, spouses, and even medical patients are not necessarily good at psychotherapy. As its name implies, a primary goal of supportive psychotherapy is to provide support to people who are going through difficult life transitions or situations, but may not have a major psychiatric disorder. An easy way to remember this is with the rhyme, adjustment disorder, just add a supporter. Supportive psychotherapy may also be appropriate for patients with psychiatric illnesses that have not benefited from other psychotherapy, but whose quality of life and coping may be enhanced by regular meetings with a mental health professional. Supportive psychotherapy typically incorporates what have been called the common factors and necessary and sufficient conditions for change. These include things like empathy, unconditional positive regard, a good working relationship with a therapist that is called the therapeutic alliance, and cultural adaptation of therapeutic style. Although these are called common factors, when we get to the section of this talk on research, you'll see that therapists vary on how well they implement these factors in therapy. So it's important to try to get to know something about therapists to whom you may refer patients. Supportive psychotherapy also often incorporates things like reassurance, advice, advocacy, and practical assistance with things like completing forms and obtaining resources. Supportive psychotherapy is an evidence-based treatment, but as we'll discuss further, the amount of benefits patients experience with this type of treatment is often smaller than for other evidence-based psychotherapies, so it may even be used as a control condition in clinical trials of other psychotherapies. Psychodynamic psychotherapy is also sometimes called insight-oriented psychotherapy. This type of therapy focuses on unconscious processes, including unresolved conflicts and symptoms that arise from past relationships. A primary goal of traditional psychodynamic psychotherapies is to increase patient awareness and understanding of the influence of the past on their current behavior. Psychodynamic psychotherapy has been practiced in psychiatry for well over a century, and Freudian psychoanalysis is one example of psychodynamic psychotherapy. Psychodynamic psychotherapies have evidence supporting their efficacy for some diagnoses, but do not have nearly as much research supporting their efficacy as cognitive behavioral therapies, and they typically take a lot longer than cognitive behavioral therapy. Years rather than weeks or months. Important exceptions include short-term psychodynamic psychotherapy, also called brief or time-limited dynamic psychotherapy, and interpersonal psychotherapy. These psychodynamic psychotherapies are brief, like cognitive behavioral therapy, typically result in similar outcomes as cognitive behavioral therapy, and focus on actively working to modify behaviors and patterns that are currently causing problems and symptoms, as well as understanding them. Cognitive behavioral therapy, or CBT as it's often called, has the largest evidence base supporting its efficacy across the broadest range of disorders. Cognitive behavioral therapies are also applied to health conditions such as pain, insomnia, and overweight or obesity. Cognitive behavioral therapies are based on experimental research demonstrating that by modifying thoughts, we can modify emotions and behaviors. And by modifying behavior, we can modify emotions and thoughts. Emotion is not targeted directly because it is difficult to change directly with psychotherapy. There are several variants of CBT that have developed over the years, but one you'll want to be aware of is dialectical behavior therapy for borderline personality disorder. This treatment greatly reduces the need for hospitalizations for self-harm and suicide for many individuals with this illness. A good way to remember this is DBT equals D-borderline therapy. Before we move on from cognitive behavioral therapies, I want to make you aware that there are actually 3 distinct types of therapy that fall under this label. Cognitive therapy, or CT, focuses just on identifying, challenging, and changing thoughts that give rise to distressing emotions and impairing behavior. Cognitive therapy for depression would focus just on the thoughts that go along with depression, such as I am a failure or I am unlovable. A patient is taught to identify and challenge those thoughts and replace them with more accurate, balanced thoughts, such as even though my boyfriend told me he does not love me and broke up with me, and that hurts and makes me sad, I have many friends and family members who love me, and someday will probably find another romantic partner who loves me. Behavior therapy, or BT, focuses just on modifying behaviors that cause or maintain negative emotions or thoughts. Behavioral activation is a behavioral treatment for depression that focuses on helping individuals with depression begin doing things that bring pleasure, give them a sense of mastery, or help them add meaning to their life. For severely depressed patients, this treatment might initially focus on things like getting out of bed and eating meals. As depression improves, or for patients who are less severe, this might focus on things like going out with friends, trying a new hobby, or vacuuming the floors. Cognitive behavioral therapy, or CBT, incorporates both cognitive and behavioral strategies such as those described. Now that we've reviewed the 3 major types of psychotherapy, an important question is, does psychotherapy work? And the answer is yes. There's actually a lot of research evidence to indicate that psychotherapy is an efficacious treatment for many psychiatric disorders. The results of a meta-analysis of 475 psychotherapy outcome studies that was published 40 years ago clearly demonstrated that psychotherapy is helpful. People who receive psychotherapy function better than 75 to 80% of patients who do not receive treatment. Usually these are patients on a wait list for treatment. The conclusions of this meta-analysis were that psychotherapy works, that there are negligible differences between types of psychotherapy, and that the benefits last and exceed placebo effects. As we'll discuss in a moment, the fact that psychotherapy works and has enduring benefits has stood the test of time and additional research. But the idea that all psychotherapy is equally effective has been revised. Before we talk about differences in the efficacy of different types of psychotherapy, it's important to note that psychotherapy is as effective as medication for many common psychiatric illnesses like depression and anxiety. In this review of research on cognitive therapy versus medication for depression, you can see in the graph on the left that those who receive antidepressant medication or cognitive therapy do better than those receiving placebo by 8 weeks of treatment. And by 16 weeks of treatment, the medication and cognitive therapy groups are doing equally well. What is important to note is what happens after treatment is discontinued. As you can see in the graph on the right, Those who had cognitive therapy seemed to maintain their treatment gains better even than patients who kept taking their antidepressant medications. So now we've established that psychotherapy is an efficacious treatment for many psychiatric disorders and often works as well for medication, and may even lead to more lasting effects than medication for certain patients and certain psychiatric disorders. But there are differences between types of psychotherapies. If you'll remember, the 1980 meta-analysis by Smith and Glass talked about the efficacy of psychotherapy in terms of the percentage of patients receiving psychotherapy who did better than patients who were on a wait list. This data has since been reanalyzed, and instead of looking at the percentage of patients who did better than patients on a wait list, effect sizes for the different types of psychotherapy were calculated. As you can see, when we look at how big the change is that occurs with psychotherapy, some differences among psychotherapies emerge. And in particular, behavioral, cognitive behavioral, and cognitive therapy seem to have advantages over supportive or humanistic therapies and psychodynamic psychotherapies. You'll recall from the earlier slide on psychodynamic psychotherapy, however, that there are certain brief psychodynamic psychotherapies, such as interpersonal psychotherapy and short-term psychodynamic psychotherapy, that may show effects equivalent to cognitive behavioral psychotherapies. In addition to there being differences between psychotherapies, there is also evidence that there are differences between therapists. If you'll remember when we talked about supportive psychotherapy and some of the common ingredients in supportive psychotherapy, such as empathy, therapeutic alliance, and other factors that have been called the common factors, research suggests that there are actually important differences between therapists in how well these strategies are employed. In fact, in a large naturalistic study in managed care, 25% of therapists reliably had results that were twice as good as some other therapists. There is evidence that across different types of psychotherapy, there are similarities that contribute to efficacy. In addition to the common factors and necessary and sufficient conditions we've talked about already, these can include things like encouraging patients to use their own skills, knowledge, ideas, and preferences, working to develop an understanding relationship with patients, working to achieve short-term changes, and constantly extending their skills by deliberate practice. In summary, there are three major types of psychotherapy. Supportive therapy focuses on helping patients manage difficult life transitions and events. Psychodynamic psychotherapy focuses on helping patients understand themselves better. Cognitive behavioral and brief dynamic therapies focus on helping patients make changes to reduce symptoms and improve functioning. Cognitive behavioral and briefer dynamic psychotherapies have more research support than other forms of psychotherapy and generally result in greater benefits for patients and are often equivalent to medications. Not all psychotherapists are equally good, so it's important to know to whom you are referring.